Definition: Vesicular reflux is the retrograde passage of urine from bladder into the upper urinary tract. The video.
I understand our daughter Elizabeth had a urinary tract infection, and our doctor had treated her with antibiotics. Would you be able to give us information about the reflux that was found on the VCUG?
So normally urine flows from the kidneys down the ureters into the bladder. Vesicular reflux occurs when urine from the bladder flows back into the ureters all the way up into the kidneys. This occurs if the valves at the bladder do not work properly, and about 1/3 of children with urinary tract infections have vesicular reflux, which is graded on a scale from 1 to 5. Urine can back up only a short distance, and that would be a grade 1, or all the way up and dilate the ureters into the kidney, and that would be a grade 5. This allows bacteria from the bladder to get to the kidneys, causing kidney infections with back pain, fever, or chill. Repeated or severe kidney infections may cause scarring and rarely lead to high blood pressure or later in life complications during pregnancy or kidney failure.
So good health-wise, been very tired. I'm also full of cold at the minute, so if I sound like a bag of shit, it's because I feel like a bag of shit. And yeah, my hair is now getting to the length where it's sticking up in certain places if I lie down, so I apologise for that, but there's nothing I'm going to do about it, so it's tough. It's very complicated, and I was diagnosed with it about 4 years ago now, September 2007. Over the course of a year, from the end of 2006 until I was diagnosed, my right leg swelled up periodically, like every...
Hello, I'm Peter Feniak. The doctor has told you that your child has been diagnosed with vesicoureteral reflux. As a parent myself, I know you'll have questions, so during this video, I'll explain what vesicoureteral reflux is, why reflux is a problem, and how reflux can be managed. Later on, we'll ask you to fill out a confidential survey indicating which treatment you prefer.
My fork now a little bit difficult.
The urinary tract is made up of 2 kidneys, 2 ureters, the bladder, and the urine, and those with mild reflux have the best chance of outgrowing it. Children under the age of 1 may outgrow it in just a few years. For others, it may take longer for the reflux to go away completely. Reflux is usually a congenital, inherited trait. That means people are born with the problem and it tends to run in families.
But it's often the first thing
if a child has reflux, the chances of many of his to prevent urinary infection. Another choice is open surgery to correct the reflux.
Without an accurate diagnosis.
And the third option,
for tens of thousands
about
living with
2 out of 10 of them will outgrow their reflux each year. This means that some children...
It goes beyond chronic fatigue. It goes beyond not being able to function on some days.
You know, horrific headaches that would put me in bed for a whole day. You know, ones that I couldn't lift my head off the pillow for the whole day.
I would get mouth sores all the time. And then as I got older, like, I started to get pain in my bones. And then one day, like, I...
Vesicoureteral reflux. Vesicoureteral reflux is a condition where urine flows backwards from the bladder to the kidneys through one or both ureters. Grade 1, urine flows back into the ureter only. Grade 2, urine flows back into the ureter and renal pelvis. Grade 3, the ureter and pelvis appear mildly dilated. Grade 4, the ureter and pelvis appear moderately dilated. Grade 5, the pelvis is severely dilated and the
Disease can affect nearly every organ in the body. Fibromyalgia, antibiotic prophylaxis, medical treatment with prophylactic antibiotics remains cardiac and joint the mainstay of initial management.
Dr. Dawn is ready for her first case, 38-year-old Robert. His embarrassing condition has been tormenting him for the last 10 years.
My condition affects my life. I struggle to brush my teeth. I struggle eating. It affects my relationship, sexual-wise. And it hurts when I urinate as well.
Rob, come take a seat.
Okay, thank you.
What can I do for you?
I'm actually suffering with ulcers. I get them in my mouth and I get them on my penis as well.
And when did you first develop these ulcers?
It's been about 10 years ago now I've been having them.
10 years.
This is like animation.
Dr.
Antibiotic prophylaxis.
Dawn is ready. 30.
Once as a child has
8-year-old
of initial UII and continues at least until managing reverse vesicoureteral reflux. If vesicoureteral reflux is seen, prophylaxis is discontinued. If vesicoureteral reflux is present, prophylactic antibiotics are continued until vesicoureteral reflux resolved or vesicoureteral reflux is surgical correct or the child rose all enough that prophylaxis is deemed no longer necessary. All children with a new diagnosis of grade 1 for reflux and some with grade 5 are given a variety of medical treatment. This consists of sedation due to aortic disease may also be seen. Problems with the heart. They may be caused by thrombosis of large blood vessels or by vasculitis of smaller blood vessels, such as the arteries providing the blood supply to the heart muscle. This can be caused fibrosis and potentially leads to reduced pump function of the heart or abnormalities of the conduction system. This is an echography.
No one can tell Joanne Zeiss what has been causing her painful eye, joint, and skin problems. After 7 years of suffering, her symptoms show no sign of letting up. Then, one morning, something terrible.
There was one day that I was working, and I remember looking down and I did a double take because I wasn't seeing something normally.
She was working as a graphic artist. She was a forms designer.
And I looked down at the page, and what I was seeing was the letters that were appearing on the page appeared broken. The lines of type themselves were wavy. And I was horrified.
Laser surgery. But that too is risky.
He said, I'm very good with a laser, but I can't guarantee that when I hit that area with the laser to seal off the blood vessels that I'm not going to destroy your central vision at the same time. I'm thinking to myself, either you cannot have